Hello, I am Dr. Dawn Godbolt, the Policy Director at the National Birth Equity Collaborative. We are a mission-driven organization focused on improving maternal health outcomes for all birthing people. Today I'm going to discuss the ongoing maternal health crisis. Despite spending an estimated $111 billion per year on maternal and newborn care, the United States has some of the worst maternal and infant health outcomes among high-income nations. And when we disaggregate the data, we see that these poor maternal health outcomes are driven by disparities between Black and white women and Native American women and white women. Black women and Native American women are 2 to 3 times more likely than white women to die from pregnancy-related complications or during labor and delivery. Black and Native American women are also more likely than white women to experience maternal health complications and severe maternal morbidity. There are a lot of reasons we see these outcomes, but I will focus on 2 overarching themes: social risk factors and systemic racism in the healthcare system. Because while the first focuses on individual circumstances, driven of course by systemic racism, the second point, racism in the healthcare system, underscores the fact that even when we control for income, education, and insurance access, Black and Native American women are still dying or coming close to it at a significantly higher rate than white women. First, I want to discuss how increased social risks negatively impact maternal health for Black and Native American women. Compared to white women, Black and Native American women are more likely to live in poverty, hazardous conditions, and experience food insecurity. They are more likely to lack access to health insurance and face barriers to prenatal care. Additionally, the Indian Health Service, a major source of care for Native American women, is chronically underfunded and does not always offer the services that are needed in a timely manner. Pregnant women without health insurance often delay or forego prenatal care during the first trimester, which is associated with higher rates of maternal and infant mortality and increased risk of low birth weight. I also want to highlight that both Black and Native American women experience physical weathering, meaning our bodies age faster than white women's due to exposure to chronic stress linked to socioeconomic disadvantage, discrimination, and racism over the life course, making pregnancy riskier at an earlier age. The second point I want to touch on is the pervasiveness of systemic racism in the healthcare system. The unfortunate truth is that racism is ingrained in the medical field, and particularly the practice of obstetrics. After all, the father of modern-day gynecology perfected his technique on enslaved Black women without consent or anesthesia. And the adverse maternal health outcomes we see today are in part due to the historical trauma of systemic racism, colonization, genocide, forced migration, reproductive coercion, and cultural erasure. There are many examples of racism in the healthcare system, and the maternity care specifically. Implicit bias can influence patient outcomes because it negatively affects interactions between patients and providers, including routine communication, recommended course of treatment, and options for pain management. The history of forced sterilization and infant separation policies has led to distrust between American Indian women and their care providers. Compared to white women, Black and Native American women regularly receive a lower quality of care, report discrimination from their healthcare providers, and report a lack of respect, autonomy, and choice during decision-making processes. And the lack of diversity in the birth worker field means that many women never have the opportunity to receive care from someone who looks like them. Frankly, it's disgraceful and shameful that Black and Native American women die at a rate 2 to 3 times higher than that of white women. The situation is dire, and I cannot express that enough, especially when we add in the effects of the COVID-19 crisis. But I do want to highlight that there are some things we can do to reduce mortality and morbidity rates. The CDC has determined that 3 out of 5 deaths are preventable. So here are a few things that we are recommending to address the maternal mortality crisis. The first is expand and maintain access to health coverage. States that have not expanded Medicaid need to do so, and we need to extend Medicaid postpartum coverage to at least 1 year, because almost 20% of maternal deaths occur 43 days to 1 year after birth. We need to develop a standardized set of quality measures so that we can accurately assess the experiences that women have. We need to increase access to community-based models which fill gaps in the healthcare system. We need to tackle implicit bias and create direct pathways for birth workers of color. Lastly, I would say let's advocate for passing the Black Maternal Health Omnibus, a federal package of bills. Thank you.